and welcome back to the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness. And tonight we're stepping into another powerful She Speaks conversation. Tonight's episode is titled Living with Sickle Cell Disease What Often Goes Unspoken. Tonight, we're talking about a condition that affects millions of people around the world, yet remains one of the most misunderstood. Because when people think about sickle cell disease, they often think about pain crises. But what they don't always see is what happens between those moments: the chronic pain, the emotional exhaustion, the stigma, the advocacy that patients are often forced to do simply to receive appropriate care, and the mental health impact of living with a condition that often goes unseen, unheard, or misunderstood. These conversations matter, especially within African, Caribbean, and other racialized communities where sickle cell disease is more common, yet conversations about it are often missing from public dialogue. Tonight, I'm honored to be joined by someone who has dedicated her career to changing that. Karen Fleming is a registered nurse, educator, and health equity leader whose passion for nursing began by watching her mother care for patients with compassion and dignity. Inspired by the difference her mother made in people's lives, Karen knew she wanted to do the same. She began her nursing career in pediatric hematology and oncology at Sick Kids Hospital after earning her Bachelor's of Science in Nursing from Toronto Metropolitan University. She later completed a Master of Nursing at Athabasca University and a Master of Science in Healthcare Simulation from the University of Alabama. Today, Karen serves as a senior health equity lead at Lakeridge Health, where she works alongside leaders across the organization to identify and reduce barriers to equitable healthcare for equity deserving communities. Beyond her professional roles, Karen has spent decades advocating for people living with sickle cell disease, working alongside community organizations, helping lobby for newborn screening in Ontario, advising Ontario Health, and championing anti racist, equitable, safe, and accessible care. Her message is simple but incredibly powerful: never give up on your dreams. Don't let anyone tell you you can't, and believe in your own greatness. Before we begin, just a gentle reminder that while we have meaningful conversations on the show, this program is intended for education and community support and is not a substitute for therapy or crisis services. If tonight's conversation brings something up for you, please be gentle with yourself and reach out for support if you need it. And if this conversation resonates with you, I encourage you to share it with someone else. These conversations create awareness, reduce stigma, and help people feel less alone. And guess what, Love Bay? The chat is open. So we would love to hear from you. We would love to hear your thoughts, your reflections, and your questions. And without further ado, Karen, welcome to the Mental Health Hour.
Thank you.
Yay, girl. Oh my goodness. The time has finally come.
Yes, it has. I'm just like my camera's looking a bit oily there.
Oh, sorry.
Just want to get it a little better. There we are. Yes.
Absolutely. Absolutely, girl. Usually I love to start off this show by asking, why does the Love Bay family need to be talking about this topic tonight?
The Love Bay family needs to be talking about this topic because I feel that everybody should be talking about this topic. It
Mm,
is deprioritized, it is minimized, and
yeah.
we have some time today to talk about it, but there's so much, and as people hear more, they're surprised that we don't talk about it more.
Absolutely, absolutely. And for those that are listening that have never heard about sickle cell disease,
Mhm.
what is sickle cell disease, and why do we need to know what sickle cell disease is? Because I think that we may hear about it in passing, but we
Mhm.
actually don't have a true understanding of how it impacts our communities.
So sickle cell disease, and it is an inherited red blood cell disorder. It's actually the most common inherited blood disorder in the world.
Mm. Wow.
And so it affects the shape of the red blood cell. And
Hmm.
the red blood cell is what moves through our body and helps us, carries oxygen through our body. So we get oxygen to our tissues, our lungs, our organs. It helps us have energy, appetite. So our red cells are super important. They give us
Mhm.
cell color. And so when the sickle cell takes on kind of like, I would say, a crescent shape of a moon, like a crescent moon shape,
Yeah.
it's unable to carry oxygen as well. And then it also
Hmm.
doesn't flow through the blood vessels as well because the actual cells are sticky and fragile.
Mm.
This genetic condition has most people, if you ask someone about sickle cell disease, they will either say, I know something about pain,
Mhm.
I know something about red cells, maybe,
Mhm. Mhm.
or I knew somebody and they died from it. That
Mhm.
tends to be like the three things. If there's three top, if you try like to tally, that would
Yeah.
be kind of like the three top answers. And there's so much more to it. And really wanting to detach sickle cell from just being a disease about
Mhm.
pain
Yeah.
and and a black disease. I spend a lot of time making sure we appreciate the spectrum of sickle cell disease and
Mhm.
to hopefully open up some minds and ears
Yes.
so that we appreciate this condition affects a number of communities.
Yes.
And yeah, so why do we have to talk about it? It shortens lifespan. It has complications across the whole body, like blood goes everywhere, so
Yeah.
it can affect every organ,
Mhm.
regardless of what sector you're in, education, healthcare. The lack of knowledge is widespread.
Mm.
So that makes it difficult for individuals who live with this condition to get support in school, to get the right accommodations at work, to have opportunities, set forth for them that supports their chronic, condition they have that is genetic. Like they inherited it, but they still need to be able to feel valued, to feel like they're contributing to the community in
Mm.
ways that are meaningful, which
Yeah.
does get done, but it's so minimized. And so, really trying to ensure that services align with the care that's needed.
Mhm. Absolutely. Something that you mentioned that was I mean, everything you said was very interesting. But what stood out to me was that sickle cell disease is not a black disease. Can you expand on that a bit?
Yeah.
Because I know some people listening, they'll be like, really? What? So drop the truth bombs. Come on, girl.
So,
Mm.
right? They will have us believe it is a black disease because when you continue that commentary, it
Mhm.
continues the oppression, the
Mm.
deprioritization. It gives
Mm.
permission to it because it's already happening. So when you
Mhm.
tie it to black people, it ties it to lack of resources, lack of funding,
Mhm.
lack of caring, compassion, empathy, new
Mhm.
treatments, protocols, care
Mm.
plans, integrated services in schools. Teachers need to know. Like it's right
Yeah.
from the beginning. This condition, okay, so, right. So let me get back because, girl, I'm telling I can go off. So I always have to say to myself, what'd she ask you? Right. Okay. So why is it not a black disease? Because I'm sure people are still like, she didn't answer it yet. So let's start with what triggered sickle cell, because I feel like that leads into the discussion around which
Yeah.
communities it impacts.
Okay.
So sickle cell was triggered by the malaria, and
Mm.
malaria
Mhm.
trying to infect the red cell. And
Wow.
in doing that, the body changed the shape of that red cell into a sickled shape.
Mm.
But if you end up with two copies of the gene that gives you that sickle shape, you end up with sickle cell
Mm.
anemia. And I'm not, even the term sickle cell disease versus sickle cell anemia means you've got two copies of the S gene. You've got hemoglobin SS.
Mm.
You've got two copies of the S gene. You could have hemoglobin SC. So it's not sickle cell anemia. It falls under the umbrella of sickle cell disease. But
Mhm.
sickle cell anemia is hemoglobin SS, the most severe form,
Mhm.
along with beta And beta thalassemia, hemoglobin S beta thalassemia, would be another inherited condition. That's part sickle cell, part thalassemia, but it's also can be quite severe.
Mm-hmm.
Once, so wherever I usually show a map, pop up a map, and I can always share it with you to share with the audience. When you
Yeah.
look at the areas that were endemic with malaria, which
Yeah.
include large areas of Africa, include areas of South Asia, especially India. India has
Mm-hmm.
the second highest concentration of hemoglobin S outside of Africa. Then you look
Mm-hmm.
at the Mediterranean, the Middle East, the Caribbean, parts of
Mm-hmm.
Europe were all endemic with malaria. And then
Yeah.
when you look at the map that's next to it, it shows you the concentration of hemoglobin S, that it's high, the sickle hemoglobin, right? So
Mm-hmm.
our hemoglobin has two genes. If you don't have sickle cell, you've got hemoglobin AA. If you're a
Mm-hmm.
carrier, you're hemoglobin AS, which is my genotype. I'm hemoglobin AS.
Mm-hmm.
If you've got hemoglobin SS, then each of your parents gave you one of the S genes, and that's how you got sickle cell disease.
Mm-hmm.
But it's really about ancestry, and it's about ancestry from any of those areas. And again, yes, although the largest population is in Africa, it still migrates. It's moved all over the world, and so we should be raising awareness to to help care not be the way it is globally.
Mm-hmm.
This information I'm sharing, experience of individuals with sickle cell, it's global. Globally, they feel unheard. I
Mm-hmm.
feel comfortable speaking broadly.
Mm-hmm.
My work is centered around lived experience advocates. When I do
Yeah.
education, they're with me. So they can share their own experiences in our effort to actually like mindset change, have people like
Yes.
change, healthcare providers in particular, change mindsets. Because that's what it's
Yes.
about. It's actually about like deep down, like mindset change.
Yeah.
Historically, we know anti Black racism, how it has impacted healthcare, but
Mm-hmm.
do we actually utilize that? Are we truly aware of it? And are we trying to change that? And if we're not, if we don't have mindset change, how will we have behavior change? Or we have to have mindset
Absolutely.
change. And so, just to finish off the not black, and so there's another map that shows that sickle cell anemia births for 2023 truly takes up like three-quarters of the world. Individuals who are not Black and have sickle cell disease also suffer in the healthcare system because people don't believe them. They will look at them and say, "Oh, you're not Black, you don't have sickle cell disease," and it's like mind blowing to me. Like no one's getting care. No
Wow.
one's getting like it's less getting good care than those who are not. This experience is more about the norm as opposed to be the exception, right? And it needs to be
Yeah.
the exception. Hmm.
Absolutely. So for those who are listening, and maybe this is like their first time hearing about sickle cell, or even like, what are some of the symptoms that someone who has sickle cell disease would have, which would maybe trigger? Because do they test for sickle cell early on? Do you have to request to be tested for sickle cell disease? Like, how would someone know if they have it?
Okay. Let's start with, do we test for sickle cell? Let's just start there. So in Ontario, we have been testing with through newborn screening,
Okay.
29
Yeah.
conditions, which has included sickle cell disease since
Mm-hmm.
2006 in November. And
Mm-hmm.
so families are told if their baby has two copies of the gene. Families are not told, though, since 2006, and yes, as a part of community work lobbying the government, I do
Mm-hmm.
believe this is under works. Hopefully, perhaps this is an additional, you know, um, advocacy effort to change this protocol,
Mm-hmm.
where families are not informed if their child has one copy of the gene, which makes them a carrier.
Oh.
And it takes two carriers, right? So if your child's a carrier and you don't know, so your kid's not going to know because you don't know,
Yeah.
then they get a partner and maybe they're a carrier, but your child, you believe they're not a carrier because you didn't get any information. And then they have a child, and what happens, you have a 25% chance, if each of us have a copy of the gene, we have a
Mm-hmm.
25% chance of having a child with sickle cell disease.
Mm.
And the message I try to share, whether it's in education, in the community, is that experience families have where they'll have a baby and they'll be like, well, how did this happen? There's no one
Mm.
in our family that has sickle cell disease. How could we have a baby with sickle cell? Well, you don't have to have anyone in your family with sickle cell disease. This is something, it's a little different than other conditions where you're like, oh, there's a history. You don't have to. You just need to have
Wow.
two genes come together, and you have a 25% chance. And so
Wow.
for me, one of the messages I also like to share is everyone should know their sickle cell status. Everybody. You should know
Hmm.
it. And part of knowing that is truly for your own health as a trait carrier, is to make sure,
Absolutely.
that if I'm at risk for kidney impact, making sure my family doctor knows that, because family doctors, I'm not even, I don't want to hone it in on family doctors, broadly across healthcare team members interprofessionally have minimal knowledge on sickle cell disease or don't have enough.
Mm,
Our nursing schools, medical schools, the amount of time spent on such a complex condition that affects, over 6,000 people in Canada, and 4,000 of them live in our province. We have over two-thirds of individuals with sickle cell in Ontario.
mm,
So whether it's one person, the experience, we need to care about the experience and ensuring that that experience is centering the patient and truly
yeah.
listening. Listening
Hmm.
is a big piece. Listening, yeah, being heard is a huge. It to me is like ultimate. Listening to the patient, believing the patient, and then providing the care that they need, not
Hmm.
that they're drug seeking,
Yeah.
because that's where they're going to go, the hospital in the middle of the night. They're going to get out of their bed in excruciating pain
Hmm.
to get high at the hospital. Like what? I don't even. Why do you know? And but literature shows when you just say sickle cell disease, there is evidence that in healthcare providers' minds, one of the things that automatically comes to mind is drug seeking.
Hmm.
Mm-hmm.
So, so talk a little bit more about that, right? Because, okay, obviously with the, and say I'm not no doctor, no nurse, so I'm doing my best to not hack it up too much, right?
You got it, girl.
So we have this sickle cell, red blood cell, and
Mhm.
this produces chronic pain in the body. Is it more complex? I'm sure it's more complex than that.
Yeah, so produces cells that clump together, get stuck, block off blood flow to tissues and organs, which causes acute pain. But treating acute pain over and over can lead or will lead to chronic pain. So it's not that sickle cell gives chronic pain, it's more so even the damage to the organs, whether it is damage to the hips. When we think about the
Mm,
hips, where it can, kind of get ground in there, you've got your hip joint, it's moving a lot.
yeah.
Maybe you sleep on that side. It can lead to a point where you're getting avascular necrosis, which means a breakdown of the bone in that area, which tends to be your hips and your shoulders in those joint areas. And so
Hmm.
hip replacements can be possible, shoulder replacements. Having a specialist is very common. An individual does not just have to deal with pain, an
Hmm.
individual with sickle cell disease. They tend to
Hmm.
have, like a eye specialist, a heart specialist, maybe lung, kidney, any organ you can think of. It is very likely they have at least one specialist, and as they get older, that specialist number will increase as the organ damage continues.
So literally, your body shuts down because the blood isn't traveling the way it should be traveling because the red blood cells are stuck together.
Yes, and when they, definitely
I'm
in a
trying to.
visual, right, kind of like yes, and then partially too more. So the sickled cells nick away at the organs. So those, if you think about a quarter moon, and you
Yeah.
think of the edges, how they can be sharp in nature when it kind of comes to that edge.
Yeah.
When it travels through the blood vessels and the organs, it's doing this little bit of damage as it floats through the body at all times.
Mm.
At
Oh
all
wow.
times when the blood is circulating. This contributes to inflammation as well, right?
Hmm.
So pain, there's inflammation that then involves the white cells, it involves the platelets. It's not just about the red cells.
Hmm.
Very complex condition. Kidney issues. The kidney environment is very, what is it? A good environment for creating sickled cells. So
Yeah.
your regular, your body's normal functions are
Hmm.
actually acting against you. And then some patients will be on dialysis. Some patients are on transfusions. It's just around the complexity of the condition. There's not enough supports in place, whether it is workplace supports for the time off, school supports so I can do my exams or do my papers, the impact neurocognitively, whether it's on learning, executive functioning, memory. Like, if we don't explore these things, and yes, studies are being done, but it's not like the school board is doing a bunch of sickle cell education and ensuring that teachers are equipped to support any students they have who might have this condition, right? And so to me, and I go back to schools because it starts there. It starts from when they're young in school, and then as they move through the school system, whether it's college, university, whatever that looks like. When you need more accommodations, the stress of exams can trigger a crisis. Right? So you got an exam coming, thinking about it, preparing. Stress can cause those cells to really start to clump and block off that blood flow. So now you're in a pain crisis. You're trying to focus on your exams. How can you do this? And if you don't have supports, you tough it out. And so I do find warriors, and that's a term that tends to be used for individuals with sickle cell disease. I do find warriors have to tough it out a lot because otherwise they if I don't go to work, then I can't make money. If I don't finish this exam, I'm not going to get to graduate. If I it's always, there's not enough of thinking, centering the individual and their condition to ensure they can achieve what they want to achieve. And it is still fitting them in the box that exists and expecting them to achieve in the same ways when they have a chronic condition that might have them at transfusions once every 4 weeks. And on top of that, there's stress and dehydration. So it's just so complex. And we haven't even really talked about mental health impact, right? And where that really starts, in childhood, when you feel bad about your parents, having to take time off work all the time to take you to the hospital, possibly. Like it's a genetic condition. Maybe the parents feel guilt, the kids feel guilty for changing plans, the lack of knowledge across sectors. So you're kind of like anxious, fearful. Is someone going to know how to treat my child when we get there? Is someone going to know how to treat me as an adult when I get to the hospital? Not knowing if you can get quality care, and not knowing, at this job, if I make it through probation, will they keep me around? And then that stress of thinking of that throws you into a crisis, and then you're having a pain crisis, and you're trying to hang on to this job. It's very heavy. It's very heavy.
Absolutely. So let's continue on that path with regards to mental health. What are the different challenges that you've noticed in sickle cell warriors as they continue to navigate this disease?
One of the things I would say I've noticed is almost like a lack of seeing the future, for some, dependent on their experience, whether it's through family or their doctor telling them, you'll live till 15, and they live to 15, and then the doctor says, okay, you lived to 18, and they lived to 18, and the doctor's like, okay, you're gonna live to 25, and this continuous death sentence. I feel it leaves you in a place where planning for the future is something you may not do. You may not see marriage. You may not see what you do in the future, like a career. There's a lot, maybe very well living just day to day. I just want to get through this day. Hopefully my pain is under control best as possible. Nobody judges me, puts me down, belittles me, doesn't treat me or respect me. It's just trying to make it. And I'm not saying for all warriors, but there's too many who live a very similar experience to what I'm sharing.
So is this common that they have a shortened lifespan, and that's why their family doctors are telling them that they're not going to live past a certain age?
Yeah, so very much it was a pediatric condition, and then prophylactic antibiotics came in for children, so giving antibiotics early in life to help prevent infection. But high 50s-ish, I would say, 50s, 60s is the average lifespan for an individual with sickle cell. We definitely have people who are living beyond that. And then to me, there's that gap there then about those that are living older. When we think about things like menopause or,
Hmm.
dementia, like how we tie that in with sickle cell, right? Because we're not,
Yeah,
I don't, we're not to say the research isn't being done, but it's going to be in its infancy because this truly
yeah.
was a pediatric condition for so long. So I feel
Mm,
for the more I interact with those who know her in their 50s and 60s and listen to their life, like their experiences and what resources you don't have. It's
mhm.
just, yeah, it's just not, it's not health equity. That's not health
Yeah,
equity. Yeah. Hmm. It's not what it looks like.
absolutely.
Hmm.
Mm, absolutely. So there's this one I can't see beyond tomorrow. I'm just trying to get through
Hmm.
today. What are some other things that may come up mental health wise for those that are navigating sickle cell disease?
So depression and anxiety definitely common.
Mm-hmm.
PTSD, I almost wonder if that's more common than really reported or shared
Mm-hmm.
from hospital experiences, just within living with sickle cell and whatever that was. A
Okay.
near life death, near death experience, maybe not
Yeah.
being believed over and over and over to the point until you're actually like critically ill and finally someone's, oh, okay, we believe you now. Um, Almost like begging for care.
But that does something to to somebody. Because when you feel like almost like the boy who cries wolf, you go to the hospital or the doctor and you're like, I'm in pain.
Mhm.
And it's almost like you have to convince other people just so that you could receive help and care. That does something to you mentally and emotionally. Like,
uh,
that's like a basic human right.
Basic
Could
human.
be.
So Mr. Alvin Merchant, a warrior, said it best one time. We were doing education and he just said it and it just froze me, just like he said to the nurses, or yeah, it was nurses we were doing education with. He said, as warriors, we have to make you comfortable to make us feel comfortable. We have to make sure we think about the tone we speak to you in, the volume of our voice, what we're wearing, what our hair looks like, how we appear, whether we disagree or not, how much we disagree or not, how loud we get, how quiet we are. So we, as the patient, we have to make the healthcare, like the nurse and or the triage nurse, the doc, we have to make you comfortable so you'll treat us. And it is true, right? The care provider has to feel some level of comfort, right? If you are coming in and you are in excruciating pain and you've waited so long to come in to receive pain meds because of the racial violence you experience every time you come to the emergency room, you come in there with screaming and stuff. Either then you won't be believed. You'll be believed to be exaggerating, and then if you're too quiet, you won't be believed because you're being too quiet.
Like, damned if you do, damned if you don't.
And most people will bring up the pit. Some people say to me when I'm teaching and stuff, they'll be like, "Have you seen the pit?" So I'll bring it in case people are listening. The pit has this great episode on sickle cell, and it really shows to me the emotional experience warriors
Mm,
go through regularly. Listen to the words. Listen to the words. Look at the dialogue. Look at the body language. They did a very good job. And I only say that when once a warrior said this resonates with me, then I'm like, okay, I agree with you. Like, you are the expert. And
yeah.
if you say that is what you feel like, not that you were in cuffs or not that it went that far for you, but that emotional experience going to you're trying to receive care, anxiety. Like people sit at home for days. I don't think people don't really like in excruciating pain. Individuals stay home for days, building up enough. Like, okay, I'll go in. I'll just take my chances because I can't do it no more. I've tried. I've
Mm,
done my hot shower. I've done my massage. I've taken my Tylenol, Advil, hydromorphone. I've slept, I've hydrated, the pain is out of control. Then they'll get to the emergency department. They'll be like, oh, why did you wait so long to come in? What triggered your pain? What were you doing right before the pain started? Like, this is not the same. Nursing school, literally, I do, I'm not trying to kibosh, but I'm saying blanket across nursing schools.
Mm-hmm.
They prepare us exactly how not to take care of an individual with sickle cell disease. Everything you need to give them poor care is exactly what they teach us. They teach us to use a pain scale, which does not work. Once a patient's having a vaso-occlusive episode, a painful episode, it's a painful episode. Check, that's it. Move on. Next. Not, okay, can you tell me what number is it at? Why? Because if I tell you it's an 8 versus a 6, like, no, right? It's ridiculous. But this is it. And we become so tied as nurses to, well, we've got to, our policy says we've got to take their pain score. Well, we can also use our clinical judgment and document that the patient refused to give us a number. Like,
Okay.
it's okay. It's okay. Like, you got to document something. I'm not saying don't document. Like, don't get me wrong. You got to document something. But it is okay to say, for this patient, we're going to use functional assessment, for example.
Yeah.
We're going to see how you came in and what's our goal. Is it for you to be able to put your shirt on on your own, to comb your hair, brush your teeth, get up and go to the washroom? What are the functional pieces? For children, are we looking for more activity? They actually reach for their electronic device.
Mm-hmm.
They're more happy, not as clingy. There's a change somehow. Not, is the number better? Like, what? And so pain score, whether it's the signs, we're meant to look for we're meant to look for sweating. We're meant to look for guarding, like, protecting of the painful spot.
Mm-hmm.
You may not see any of that. You may see someone who's very straight. They may look exactly like I look.
Mm-hmm.
Exactly the same. Why? Because they've been experiencing pain so long that they know putting on the true feeling can delay care. And so some are just tired. Like, I've cried all the tears I got. I'm done. It makes no difference anyway. So I just might as well go in and just tell them exactly what I'm experiencing. It's, yeah. And I lost track of where, this happens sometimes. I started, I went off track. But I'm flabbergasted by, oh yeah, nursing schools. That's where I was, right? Pain scale, right? Signs to look for.
Mm-hmm.
Even the types of questions you ask. There's a PRQST, nurses will be, if there's nurses listening, they'll know. I might have missed a letter there, but there's a specific acronym we use to assess for pain. But it's different, what were you doing before the pain started? What triggered your pain? How long is it? And those are not the questions you want, no. It's a vaso-occlusive episode. Please tell me, where is it located? Has it stayed there? Does your pain tend to move? What works best for you? Like, let's
And
just
I
get.
can imagine like having to repeat the same story over and over every time you go into the hospital, because it's not going to change. The history is not going to change, but obviously who you may come across at the hospital is going to be different. So you're having to give the same information over and that in itself can also be exhausting.
Mentally training. And then you tell a doc, right? And then someone else new is going to come on because that doc leaves 2 hours later, and a new doc comes on and is like, oh, so, tell me what's going on. And it's like, but don't you guys talk to each other? No, that's not patient-centered care. Like, don't think because you went to the patient to ask them something that they've told people 5 times over already that you're being patient-centered. No, we have to find somewhere in our charts where you can find that information, and then you're going in there with very purposeful questioning, right? To partner with them. There's times, and it's both sides, discomfort. One of the things I feel is the biggest barrier to care is the discomfort of team members, right? Whether it's the physician's discomfort with increasing the dose, giving it more frequently. Oh, I'm not comfortable with increasing the dose. Let's just leave it where it is tonight, and in the morning the day team can take care of it. Like, these are like, or for nursing, oh, I'm afraid of losing my license and contributing to your addiction, so I'm not going to give you your opioids. What? That's insane. I'm not saying don't use your clinical judgment. People will be like, oh, well, I have to assess the patient. And of course you do. Yes, of course you got to assess the patient. And you're going to see. And when you maybe walk in the room with your patient, make an agreement. When your rest
Mm,
at 6, if your rest go down to 6, I'm going to have to call the doctor before I administer your pain meds, so that it's not this like surprise. Work as a team, like actually partner, right? To
yeah.
success. And there's too many patients not experiencing that I can say it, that it's missing. It's a missing piece, is truly partnering with the patient, being their advocate. And for those that do it, they sometimes meet resistance, right? So now they partner with the patient as the
Mm,
nurse they go to the doc to advocate, and the doc shuts them down. What's going to happen the next time? They're not going to do it because they're going to feel that I'm going to get shut down again. So, I know it doesn't
mhm,
work. So that doc's on again. Like, it's crazy. Discomfort. Discomfort cannot impede care. That's that's where it kind of leads. Discomfort cannot impede care. What are you going to do to help your comfort? Are you going to speak to a colleague, a charge nurse, speak to the pharmacist, the doctor, the sister unit, call the dedicated center, call e-consults, CAMH virtual pain hub? Like, what are you going to do? And instead it's okay, I can't do anything, so I'm going to do nothing.
mm,
And that strain, right? We're still in mental health, right? All of this, to me, if we think about the experience when you when they do go in the hospital, where their actual treatment is going like
mm,
this, dependent on which provider team is on, as a whole team, is sad. It's like, do you actually want to get them out of the hospital? Don't we want to provide high quality, consistent care?
mhm,
So and those days away from work, away from family, away from school, on that contract job, very hard to find a full-time regular job if you're a patient who has unexpected absences,
yeah.
right? It's unexpected. It's not like the pain knocks at the door and says, hey, you know, get ready in 2 days. I'm going to have a vaso-occlusive episode, which employers ask sometimes. They'll be like, don't you
Mhm,
know what's coming on? No, it's unpredictable, which makes that's one of the big issues, or the biggest issues, is that it's unpredictable. You could be on the beach chilling out, having a good time with your family, and boom, it's time. We got to go.
mm,
We got to go. We got to go get to a hospital. It is unpredictable, right? And maybe when you look back, you're like, okay, well, the day before, you know what, I didn't really drink a great amount, or, I did kind of go to groceries and then I spent a bit of time out late. Like, this navigation of how much activity can I do to prevent myself from having a pain crisis is a thing. So,
mhm.
fatigue, on and on and on. Fatigue's another thing. And we know anti-Black racism lends to this conversation of Black people being lazy. And so it then lends to that too. I'm employed, my employer thinks I'm lazy, that I'm not really sick. I couldn't really have this unpredictable pain condition.
You are listening to the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. Tonight we're talking about living with sickle cell disease, what often goes unspoken. So much of this journey happens quietly, the pain that isn't always visible, the emotional weight of living with uncertainty, the frustration of not always being believed, and the resilience it takes to keep showing up. If tonight's conversation is resonating with you, take a moment to like, comment, share, and subscribe. It helps us continue bringing these important conversations to more people and more communities. You can also download the Love Bay Radio app from the Apple App Store or Google Play and listen anytime. Visit lovebayradio.live, that's LUVBAY radio.live, to listen live, support the station, and help us continue these conversations. And if you have a question or would like to join tonight's discussion, the chat is open. You can also call us live at 437-778-3299. We'll be right back. Okay, girl, I'm gonna out myself because I love to out myself at least one time
Yes?
per per episode. So you know how you were talking about the pain scale? Listen,
Sorry.
if you asked me on a scale from 0 to 10, how much pain? I'm gonna say 10. I'm going to say 10. Don't ask me that question.
Right? So they say 12. They'll be like 12. Like, it's beyond what you're thinking. So let's move on. Like,
I said I'm
and
not.
then they won't believe it. They'll be like, I don't think your pain could be that bad.
Yeah, that's it. Anytime I had a procedure, and I remember starkly when they say, Felicia, are you feeling any pain? I always say yes. on a scale from 0 to 10, I said 10. And then I
That's it.
pass out and I don't remember. So, yeah,
So
ask me
we
the
get it.
question. I have my answer waiting for you. Okay.
I love it.
But I can't even imagine because we know that with chronic pain in general, there's um, an issue of when people can't see
Mm-hmm.
that you're in pain, they
Hmm.
don't believe you.
Correct.
And then this is just another additional layer because you get flare ups so often. And then obviously there's the racism and the systemic injustice and the barriers that, we often have to navigate. And then you're fatigued because you're constantly telling people about your pain over and over and over and over and over and over again, which causes like a mental fatigue, right?
Mm-hmm.
That's a really heavy
Mm-hmm.
bag to carry,
Mm-hmm.
you
And
know?
around, right? Like we're not even talking about having children and having to manage, other people you're caring for. It might not even be children. Maybe it's a loved one, a mother or father or brother or sister having to play the other roles. Hmm. How do you keep that up? Right? Keeping that up, like the juggling is, my heart breaks.
Mm.
Yeah.
So, for those that are listening that may know someone that has sickle cell disease,
Yeah.
how can they be a support to those loved ones and friends?
Hmm. I think you should ask them. I think if you know someone who has sickle cell
Mm-hmm.
disease, you should ask them, if you're having, or maybe tell them, I would start with, how, would you mind sharing with me what sickle cell is like for you
Mm-hmm.
before I go into, when you have a pain crisis, can you tell me, I listened to this education and I know you have pain crises, so let me know, how I could help you best. No, because then you're making assumptions. Every single person's experience is different. There can be an individual with hemoglobin SS who does not get admitted for pain crises. There could be a patient with hemoglobin SC who's admitted 5 times a year for pain crises. So I would ask them, what is the experience like for you? Are there times when you do have to go to the hospital, or does that not happen for you? Or, but
Mm-hmm.
more being curious about what the experience is like for them. And I think a listening ear is very welcomed, right? Isolation's a big
Absolutely.
thing. So just,
Absolutely.
right, giving that space for them to share, and then, maybe asking, what is one thing I could do for you
Mm-hmm.
if you do a pain crisis? What is one thing I could do for you in those moments? Because asking
Mm-hmm.
in those moments, we all know, like when we're having pain, being able to think clear is just not on the top of the list at all.
No.
So, or being able to communicate our needs. So therefore, asking ahead of time, would it help for me to ensure I'm available to take you to the hospital? Like try my best to do
Yeah.
that, or is it helpful if I come and visit you in the hospital within a day so that you have support with you? Is it helpful for me to be at your house when you come home and you're discharged to help with cleaning, cooking, helping get around the house? Because when you come home after you've been admitted um, for a pain crisis, the pain still continues. Like individuals with sickle cell hardly ever have 0 out of 10 pain, like have no pain. And not all
Mm-hmm.
individuals. Again, there's some who do, but majority or a good number live with pain on some level on a daily basis. Like have a baseline pain score that is not 0.
Mm-hmm.
And so when we're discharging them from hospital, we're not always trying to discharge them with a 0, which is what we're trained to, right? We're also trained that in school. We're trained to like get rid of the pain, right? We want to make it better. Nurses feel
Mm-hmm.
helpless, right? Some nurses still feel helpless with individuals with sickle cell because you will try your best to give them everything that's ordered. And
Mm-hmm.
the entire team is not on the same page about the dosing and the frequency. It impacts care. There's
Mm-hmm.
if the patient cannot get the amount they need at the frequency they need it, without judgment and without delay,
Mm-hmm.
then we're just going in circles. We just go in circles, literally. You're just like, but they're not getting
Mm-hmm.
better. Well, they're not getting better because you haven't made a change. You have to get
Mm-hmm.
out of that discomfort zone and recognize this patient has been on opioids like since they were a child,
Oh,
unfortunately,
wow.
right? Like
Mm-hmm.
flare-ups can start 3 to 4 months of age, right? We're talking babies. And so we're thinking
Mm-hmm.
about a 25-year-old. It's been 24 years of possibly being
Mm-hmm.
opioids, and really setting that in your mind to know like your worries about their safety are truly not totally valid. Like, and I do challenge nurses in particular around,
Mm-hmm.
respiratory depression, blood pressure. Actually, being tolerant to opioids protects you against respiratory depression. So you should feel better about it, to be honest. And so it's when you
Mm-hmm.
talk about the receptor that triggers respiratory depression is blocked when you actually have a lot of opioids, which
Mm-hmm.
is not particularly a good thing, but it is a good thing in this situation for them to get the pain meds they need and not be
Mm-hmm.
worried about some of the things that are reasonable to worry about, but you need to put it into the context of the patient and what
Right.
really works well for them and safety for them. Like, have they had an episode where they had some sort of, respiratory depression, they needed Narcan, and so reasonably so you're nervous? Or is it just the concern of what could happen, which could be with any patient at any time, right? So we
Mm-hmm.
can't work off of that.
Absolutely. And we have a question in the chat
Okay.
from A B C D E F guy one. All right. And they say great discussion compared to when I was in nursing, so grad 2000
Whoa.
to now, right? I find that more info on sickle cell management is discussed in nursing school. What are your thoughts? That's all you, girl.
Right. Thank you, ABCDEF guy one. I So I graduated in 2002, so you're just before me. Congratulations. And I agree with you. There is more, but there's not enough. And I also don't think it is discussed within a framework of anti Black racism or cultural humility, whichever we want to pick, what makes us more comfortable. It's spoken about as, just like as a medical condition. And if we do
Mm,
not speak about the social aspects that impact their experience and how we as nurses can help actually move the needle forward for health equity, ensuring that we champion care that is of an excellent nature without waiver,
mm,
right? That's our responsibility. And so I just don't think nursing school, and I wonder too, like maybe where did you go to nursing school? That might be a question. And maybe some schools maybe have a bit more than others. But I just did education with some peds nurses, and there was new grads in there less than 2 years, I think 2.5 years. And I asked them, and they said no, they didn't have any sickle cell content. So I think it just wavers, and I think we're at like an hour. Like it's not. It's this. I just don't think it's valuable enough. I think it's a way of putting it in there, but they can't take that information and truly then apply it in a way that you're looking at the whole care picture for an individual sickle cell. But I'm interested if you want to share thoughts, you can share your thoughts back. Thank you for asking.
absolutely. So, what is health equity, Karen? What is health equity?
Oh my gosh.
Mm, girl. Mm-hmm.
You know, if I'm just being like really broad, I do think it is everyone having a, a fair and equal opportunity, because it would be equal if we actually did the equitable pieces. It would be an equal
Mm,
opportunity to have the best health and life. If you have the best health, I do think that the best life, but best health possible.
mm-hmm.
And what does that really look like? Right? Like
Mm-hmm.
our healthcare systems are not built for that. We're reactive in nature. All right. People come,
Mm-hmm.
they come with their concern, but then once they come with that concern, we are not then now like, okay, how do we make sure they don't come back with this? How do we reduce the chances of them coming back with that very concern? And
Mm-hmm.
so we enjoy keeping our patients in the system. Um, and so I just wonder how are other systems, like I do know there's some systems that include things like an emergency department for individuals with sickle cell that they can go to. And infusion clinics are huge in the U.S. A day hospital infusion clinic, that would be amazing because it
Mm,
would give a space that could, and you'd want it to run, at non-typical hours. All right, so you'd want it to be like something like 6 in the morning. You can come before work, and we run like to like 11 p.m. So you can come
Mm,
after work, maybe put your kids to bed, and then you need to come. But it's about being able to access culturally affirming
mm,
care, that
mm,
you have providers who definitely know about sickle cell disease. So you are walking in feeling like a warm hug. I would love to
mm,
have like infusion chairs. They have this in the States. They got a sickle cell sanctuary. Shout out to the sickle cell sanctuary. I think it's in Georgia or somewhere, but it's beautiful. Um,
mm. Wow.
it's act like massage chairs as they're getting their transfusions, warm colors, couches, these things that help the mental peace. I think, but being able to really get hydration, being able
Yes,
to get pain meds, and being able
yes.
to get any psychosocial support, having that available outside of a hospital would be
Mm,
fantastic. So then they can access that. Maybe you come for 2 hours on Thursday and you're like, you know what? I just want to make sure for the weekend I'm good. Hey, come back Friday. Come back on Friday. Hey, we're open on weekends anyways, because you want to ensure the services are actually aligned with what clients need. Don't run
yeah.
them 8 to 4. How
Mm,
can they access the services? They got to work too. So how do we
mhm,
ensure then from 4 to 10 p.m. exact, for example, you can still get high quality care. You can still get, the
yeah.
doc who's got the knowledge, the nurses who are still very invested. You're not waiting because it's
Mhm.
you're still able to get high quality care, and you don't have to go to an emerge. You're not waiting. You can book times. I'll be in at da da da.
Yeah.
Yeah. And then opportunity to talk maybe about a pain care plan and those pieces, being able to help
Mhm.
coach and mentor and educate. And to me, that would immediately reduce emergency room visits. There has been a pilot study done in Toronto. It did show good results. Well, where is it? Why don't we have more of them?
Mm,
It's very broken system.
absolutely. I really wanted to also make sure that I carve out time with regards to the conversation on like blood transfusions and the importance of that, because I know you invited me to an event the other day, and that was one of the big topics, right? And
Mm-hmm.
so, yeah, please share about the importance of, donating blood
Mm-hmm.
and what that means to someone who has sickle cell disease and why it's important to donate.
Yeah, thank you. Canadian
Mhm.
Blood Services, I feel like they actually truly have quite a few ads out right now saying that their blood donor pool is very low, lower than
Mhm.
expected. So they are actually just putting out a general call. But
Mhm.
besides that, excuse me, some individuals with sickle cell live on chronic transfusions. So their hemoglobin runs at a level where they have to get a transfusion, every 4 to 6 weeks.
Mhm.
These transfusions do expose them to iron. So, as in addition to what they have to deal with, they then might be on an iron chelator, which will help clear their blood of that extra iron, because your body, it's dangerous to have too much iron in your body,
Mhm.
right?
Mhm.
So, maybe that iron chelator is something that they're taking in their mouth, it's oral in nature. But it could be subcutaneous. It could be now at nighttime when they're sleeping, they're hooked up to a machine that's running for like 8 hours, 10 hours overnight to help clear that iron out of their blood.
Mhm.
So it's important for that. It's important for patients as well who maybe they had a stroke, for example, because unfortunately, for example, children
Mhm.
under 5 years old are with sickle cell disease are at a 300 times higher risk for stroke under
Oh,
5.
wow.
Think about being a parent, right? I got to worry about my child's risk for stroke. You've got to definitely worry about infection for children. Infections, big risk. Very, you can, fever is something that's like, and that's another thing, right? Like daycares, right? They got to know that fever, you can't play around here. Like I know they call you anyways to pick up your kid with fever, but I mean, like, you know, for a child with sickle cell with fever, you've got to come immediately. No waiting, and recognizing that it's a medical emergency so that you're monitoring the child appropriately.
Mhm.
And so whether I'm worried about stroke, I'm worried about fever, I'm worried about splenic sequestration, which is the pooling of little sickled cells in the spleen. And so
Mhm.
families are taught how to actually palpate or touch, feel for,
Mhm.
assess their child, their
Wow.
spleen, right? And so the mental load on families who
Mhm.
have children with sickle cell disease is something else that's not talked about enough, right? Whether it's
Mhm.
your child's just been newly diagnosed, the mental health impact that can have, because you're your husband was tested, you were told negative, you were tested, you were told you were good, and something went wrong somewhere, but you have a baby with sickle cell. And just being able to move through that time, I think that really that new diagnosis time is really a time for us to pick up and make sure that we're not losing, or we're really wrapping our arms around new families getting diagnosed with sickle cell. And then
Mm,
continuing that support throughout is super important.
absolutely.
Yeah. Oh, blood transfusion. Sorry.
Absolutely.
Yes. Oh,
Yeah.
sorry. So yes, they're important for stroke, and they're
Yeah.
also important for those that maybe have frequent pain crisis. And so there's only two disease modifying therapies. We won't get into that and how long that's been kind of in existence for individuals with sickle cell, like decades. I
Hmm.
wouldn't say over a century, but okay, maybe decades. Let's go decades.
Mm.
Hydroxyurea, which helps them create more baby hemoglobin, hemoglobin F, and therefore decreases the amount of hemoglobin S, which helps to decrease the amount of pain crisis, decrease hospitalizations, decrease
Mm.
complications. I look at it as a way of extending life because it helps to decrease the amount of sickle cells flowing and nicking away at your organs and blood vessels.
Wow.
One choice, but it has to be taken every single day. It does not work for everybody. It can affect your body in multiple ways. So that is one
Hmm.
choice. And then the other choice is red cell exchange or phlebotomy, transfusion. They all kind of fall in the same bucket. But you could go to a hospital, one of two, St. Mike's or UHN or Sick Kids, and you could get a red cell exchange where you're spending pretty much 5-ish hours of the day, and they're exchanging your blood. They're pulling off your sickled cells and they're giving you a blood transfusion as well. And
Hmm.
that's to reduce the concentration of sickled cells in your blood.
Mm.
And so having that blood to transfuse is important. So for those that are on a red cell exchange program or
Hmm.
a chronic transfusion program, either way, it does help individuals with sickle cell. And on top of that, ethnically matched blood is better. So it is
Hmm.
better for us to have blood from the community in which we match. And so that
Yeah.
disproportionately it affects Black people. Disproportionately means it's avoidable, right? But disproportionately affects Black people. So we do need Black people, African Caribbean Black people to think about donating. And if I can toot a horn for a little we do have a donation clinic coming up actually.
Yeah.
Taibu and Canadian Blood Services, they are having a blood donation clinic on August the 28th.
Yes.
And it's from 2 till 7, and it's located at Taibu Community Health Center. And so
In
if you want
Scarborough, Ontario.
Scarborough, so if you want to donate blood, right, it's going to certainly hopefully be in a space where you do feel culturally safe. It is in a space that has that is built for African Caribbean Black people to come together and to be in community. And we did have a kind of launch event in June, and so now we're going to have a blood donor clinic and even like a blood donor visit. We're going actually out to go visit the blood donor. What's it called? The place where they do the blood donor, they take it and they manufacturing kind of department thingy. There's one in Burlington, so I want to go
Wow.
check it out, right? Because I haven't.
Wow.
I think it'll help me. I'm one of those like I want to see like what you doing with what you doing with the blood. Like I want to
Wow.
right. So it's cool. So they're doing that August 13th. So you can
Oh,
through
that's
Felicia, you can
awesome.
get in touch with me if they want more info. I certainly can. Yeah.
Absolutely. Absolutely. And who would be like a good candidate? Like, I know that we talked about having ethically matched blood, but do you have to be a particular age, or is that more
Mm,
preferred, or is it just
right.
anybody?
My recollection, any age can donate blood,
Mm-hmm.
and they will check your your baseline count when you arrive to
Mm-hmm.
donate blood. To me, it takes a very short period of time, I think less than an hour, to actually donate quite a good amount of blood.
Mm-hmm.
And you can, if you cannot donate like whole blood, which would include red cells, you could donate plasma. Oh, but not, sorry, not at our clinic, but there's a donation center in Scarborough near the Scarborough Town Center, actually.
Mm-hmm.
So you could donate plasma. So there are different things. And if you do go on the Canadian Blood Services site, I truly think you'll find quite a few different ads that are going right now that really is promoting blood donations. And then they also have a new team that's really looking into the Black community, African Caribbean and Black community, and increasing donation in that community. And I see Juliet there. Said, thank you, Juliet, for letting us know your name. And thank you for saying you're going to take information back. Yay, you're a nurse educator. I love that. We love that, right? That's how right? Like right there, one person. That's all you
Yeah.
hope for, is one person will take something and tell somebody else or a number of other people. And we just got to keep building the conversation and awareness and,
Yeah.
yeah, importance.
Absolutely. Yeah. I know that you talked about the importance of self-advocacy, right? Especially, as you navigate the healthcare system. So, what are some ways that those with sickle cell disease can continue to do that effectively? And what can other people do, like family members, do to also help to advocate for them when they're maybe having like a flare up or a pain episode?
Mhm. I would actually start with the individual themselves and ask
Hmm.
them what they feel would be the best way. But some
Yeah.
examples to me would, being able
Hmm.
to go to the hospital with them if they have to go, right? Having
Hmm.
someone with you when you're in pain, it helps. And understanding what their message is, like what they hope to get out of care, like what are their pain goals, so
Hmm.
that you can communicate that in a way in case they can't. You're truly being that advocate who can share, we spoke, I know this is what she wants, this is what works well for her. Being able to do that. I think there's opportunity really to record some stuff. Like, I feel like when you're not in a pain crisis, perhaps you could record a little video or something saying, like, very coherently while you're not in pain, this is what works well for me when I'm in a pain crisis. And I know that you may not believe that I'm having as much pain as it seems, but I have had sickle cell disease all my life. I was born with it, whatever it looks like. Right? But could that help? Perhaps. Like, I think we have to think about
Hmm.
creative ways of being able to communicate exactly what's happening, um,
Yeah.
and hopefully that people will believe and actually trust. But being there for them and speaking up. And if you see behavior that's not appropriate, speaking up about it and ensuring that, whether it's through patient relations, the manager of the area, making sure that those occurrences are reported so that change can happen.
Absolutely. Absolutely. You know, the advocate in me is like, so where can I sign? Who can I lobby for change? Because I feel like this is something that needs to be talked about a lot more. And yay, Juliet girl. Juliet is yes, a nurse educator, and is so happy that you're going to be bringing this information back. And yeah, I mean, I'm a big advocate that we could all throw a pebble in the ocean, even though it's a huge thing, but we could all create change in our own way,
Yeah,
right? But for
exactly.
those who are interested and they're like, this is unbelievable. I can't believe that they're not believing, those with sickle cell disease. What
Hmm.
can they do to create change even in their own circles?
Hmm. I think speak up about it,
Mhm.
raise awareness in your own circles, ask questions. Do you guys know about sickle cell disease? Do you know your sickle cell status? And you will be surprised, possibly, that someone is going to say, "Oh, I know someone with sickle cell." It generally,
Mm.
for me, that always someone will be like, just the other day, someone was like, "Oh yeah, my dad has sickle cell disease." Oh yeah, one of the nurses in our class. Oh, my dad has sickle cell. I was like, it.
Mm.
You find it in more places than people think. It's not as rare, although it's considered a rare disease. It's not as rare as we think. Um,
Mm.
so yeah, just needs more attention.
Mhm. And if you could give a word of encouragement to those who may have sickle cell disease and we're preaching to the choir basically about their own lived experience,
Yes.
what would you say to them tonight as they're listening and tuning in?
I would say wholeheartedly speak up for yourselves. You need to know about your disease so you can inform others,
Mm-hmm.
and do so in a way that you get the respect you deserve and the
Mm-hmm.
care that you need, not want. It's not like you're here and I'm seeking and I'm wanting. I need this care.
Yeah.
So really looking for, how can I ensure I get the care I deserve?
Mm-hmm.
Yeah, and continue. Very much so, warriors are resilient, but part of why you're called warriors. But not always wanting to fight, so being able to rest as well. Yeah, really important.
Absolutely. I'm gonna hit all of them. How about the employers? How can they be more kind?
I think employers need to, if you get patients with sickle cell in your hospital, healthcare organization, ensuring that you're looking at the Ontario Health Quality Standards released in 2023, so you can align with the best practices for Ontario for high quality care for sickle cell. And so using those, implementing them, holding team members accountable when they're not meeting those expectations.
Hmm. Absolutely. Okay, girl.
Well, thank you.
Now, yeah, clock it. Now, if you could drop one last gem tonight for the Love Bay family, what would it be as it pertains to our topic?
It would be we are stronger together.
Hmm.
We have to do this together, collaboratively, cross sectors, across communities, stronger together.
So powerful. So powerful.
Thank you.
So as we come to the end of tonight's conversation, I want to leave you with this thought. Sometimes the greatest challenges people carry are the ones we cannot see. Living with sickle cell disease is about so much more than managing physical symptoms. It can mean navigating chronic pain, advocating to be believed, confronting healthcare inequities, and carrying an emotional burden that often goes unseen. Tonight reminded us that when we truly listen without assumptions and without judgment, we create space for healing, understanding, and change. I want to extend my heartfelt thanks to Karen Fleming for sharing not only her knowledge and expertise, but also her unwavering commitment to advancing equitable, anti racist, and compassionate care for individuals and families living with sickle cell disease. Go, girl.
Thank you. I appreciate you inviting me, Felicia, very much. So thank you for giving me
Oh,
space.
girl, we're going to have you back. Trust me. Hey,
So,
again, thank you for the work you do every single day to improve the lives of those living with sickle cell disease, and for reminding us that health equity isn't just about equal care. It's about ensuring everyone receives the care they need to thrive. And to everyone listening, whether you're living with sickle cell disease, supporting someone you love, working in healthcare, or simply learning alongside us tonight, thank you for being part of this conversation. Awareness creates understanding. Understanding creates compassion, and compassion has the power to change lives. Before we go, I'd love to invite you back next week for another important Baba Shop Tuesday conversation. Next week's episode is titled When Depression Looks Like Anger, the Hidden Face of Men's Depression. What if the man in your life isn't angry, but depressed, and you've never been taught to see it that way? Depression in men doesn't always look like sadness. It can also show up as irritability, anger, emotional numbness, risk taking, or withdrawing from the people who care most. We'll be unpacking why depression in men is so often overlooked by partners, healthcare providers, and even the men themselves, and what it really looks like to ask for help before it's too late. It's going to be an honest, eye opening discussion, so we hope you'll join us. Thank you for spending your evening with us on the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. I'm your host, Felicia Fishoff. So until next time, take care of yourselves, take care of each other, keep having the conversations that matter, and remember, sometimes the most powerful thing we can do is listen to the stories that have gone unheard for far too long. Good night, everyone.